When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is highlights from our Going Integrative Plus community calls, where real people get to ask the top holistic cancer doctors in the world anything they want, each and every week. Stick around at the end to find out how to be on these calls, asking the questions yourself, but in the meantime, enjoy and take something you can use right now from the show. There's a lack of truly holistic healthcare that inspired Dr. Orton and Dr. Orada to start Haven, a holistic health center in Chicago. Haven creates individualized health programs for people to be educated and empowered to know exactly how to optimize their health and heal from chronic illness. Dr. Orton understands that healing is a journey. Indeed it is. It must be tailored towards each person. I saw a lot of customization in your programs, Dr. Orton. I'm excited to dig into that more.
So what me and my buddy Colby, I grew up with Colby, so he's a friend and my colleague with Haven. We saw a real need in the alternative medicine space from what we were being exposed to at school, because a lot of what we were learning and a lot of what people were doing is what we call green allopathy. You're basically running blood work and then prescribing supplements in the same kind of philosophical foundation that you would do that with drugs, right? So in our perspective, that can help. It's not to say that, that's worthless. But when you have a chronic problem, typically that's not going to get you to the mountaintop, right? You need to have a plan that is addressing the true foundation of how we create health in the first place. And so much of that comes from the way that we live, the way that we think, what we do every day, our daily practices. It's like you can balance someone's blood sugar, but if they're running around like a crazy person and they're not eating barely throughout the day, then that's the real problem, right? So we found that a lot of what is still happening in the alternative space is still kind of Band-Aid, like, nice supplements to kind of help people to bolster their health, but not really having the conversation and the deep dive to understand where's this issue coming from and how can we create that in your life so that you can fundamentally heal and stay healthy for a long time. And that's what I really like about the Gonzalez protocol, because the Gonzalez protocol is about taking action into your own hands and making changes in the way that you live on a day-to-day basis, right? It's different in that way than many other cancer therapies and kind of degenerative, like treatments for degenerative disease that are getting more and more like technologically advanced with lasers and IVs and this and that. Again, has its place, can be very powerful. But I do believe that the foundation has to be there in order for those therapies to have the benefit that they're really going for, because if you're doing IVs and lasers on a faulty foundation, and the person's just going to revert back to where they were. So that's kind of, I got into the Gonzalez protocol as a natural kind of progression of the framework that I was already coming from. You mentioned how, you were kind of waiting at the edge of your seat for someone to like take up the torch with the Gonzalez protocol. And, the reason why there was that delay, I can speak to that, is that Mary Beth and the people that she brought on her team, of course, Mary Beth is Dr. Gonzalez's wife. and who's the president of the Gonzalez Foundation, she really wanted to make sure that she honored Nick Gonzalez's legacy and really did the protocol justice, and of course, you can understand if you're in the alternative medicine space, it's very easy for something to get a bad name or for people to misuse things and then have anecdotes that like really taint the whole picture, right? Which can then dissuade people who would otherwise benefit from it from doing it because they're seeing like a headline. So I really applaud Mary Beth for her patience with it. She wanted to get it launched more than anyone. But we really took a lot of time to make sure that we did all the research and we compiled all the materials in a thoughtful manner. And we're just getting started. We have a big group, and we're all seeing patients now that are going through the Gonzalez Foundation website. So it's exciting. It's still a new endeavor for all of us that are starting to see patients now.
Has anything changed there as far as the official protocol goes, or do you have your own ideas on enzymes that you're adding to Dr. Gonzalez's work with? Or talk to us about enzymes, Gonzalez protocol versus what Dr. Orton thinks about enzymes.
Yes. So I'm doing the exact same thing that Dr. Gonzalez did with his patients. The enzyme issue was really important for Dr. Gonzalez when he broke away from Dr. Kelly, because what was happening was that the enzymes that Dr. Kelly was using were not formulated properly, is one of the issues that led to the Kelly program downfall. He was working with supplement companies, because remember, this was in the mid 80s. So supplement companies and supplement manufacturers were not nearly as prevalent as they are now. And there were some really poor manufacturing issues that were going on that were potentially leading to poor enzyme potency. And that was one of the factors, at least, that was causing problems for Dr. Kelly towards the end of that era of his practice. And Dr. Gonzalez ended up going his own way, and he had to figure out what he was going to do about the enzyme issue. And what he found is that the freeze-dried pancreas has enough of the enzymes in it to be potent to work at the right dosage, but it was also very stable because it has the fats and proteins and other things in the natural pancreas to keep it shelf stable for a long time. So reading through his books and understanding his logic makes perfect sense to me. It's easy to get them. They're widely available as glandulars. So that's still what we use. It's a tried and true method.
This is probably where we should have started. Can you give a brief overview of what the protocol is?
Dr. Gonzalez was a journalist for Time magazine before he became interested in medicine. He went to medical school, and because of his journalistic background, was introduced through a friend to Dr. Kelly, who basically said, hey, you got to meet this guy. He's doing some really amazing things with cancer. Was kind of hesitant to meet him because Dr. Kelly had a lot of bad press from Steve McQueen passing away. Ended up meeting with him, was impressed by their initial conversation. Dr. Kelly convinced him to go out to Texas and look at his case files on the results that he was getting. And Dr. Gonzalez flew down there, looked at the case files, and he was like, holy crap, this is unlike anything I've ever seen before. Brought some cases back to Dr. Robert Good, who was his mentor at medical school. He looked at the case files, agreed. They were stage 3, stage 4, poor prognosis cases again and again that were still alive 5-10 years later, that had done a completely alternative treatment, which was just completely unheard of. So Dr. Gonzalez ended up studying with Dr. Kelly over at least a summer during medical school and into his residency, and then longer after that, and kind of was at a crossroads and had a really good immunology kind of fellowship that was laid before his feet with Dr. Robert Good. And he decided to go the other way and work with Dr. Kelly and learn Dr. Kelly's method. So this protocol was discovered by Dr. Kelly and formulated over the course of a decade. But there's basically 3 prongs to the protocol. Number 1 is an individualized diet. And it's a traditional whole foods diet that is anywhere from highly plant-based to highly animal-based, and in between, depending on your acid alkaline balance and your sympathetic parasympathetic balance. And different cancer types tend to fall into different categories along that spectrum and need oftentimes opposite diets. Prong number 2 is supplements and enzymes. There's a lot of supplements on the protocol because the idea is that you have to support the whole body with every vitamin and mineral that the body needs and support all the organs that are weak. So there's a lot of glandulars and then vitamins and minerals that are used at specific doses depending on your metabolic type, where you're at on the metabolic spectrum, because just like food has acid and alkaline qualities that can affect where you're at and that balance, vitamins and minerals also do. So you have to get the right vitamins and minerals for your metabolic type to create balance, but you also need all of them, right? Because the body needs all of these essential nutrients. So you take a lot of supplements, including the pancreatic enzymes that are taken at high doses away from food. When you take them with food, they digest the food. When you take them away from food, they're actually absorbed into your bloodstream. And they've done studies to prove that this occurs, despite that they're going through your stomach, they're being exposed to stomach acid. They've done mouse studies where the enzymes remain completely intact, going through the GI right into the bloodstream. And when you take them in between meals, you're getting a high concentration going into your bloodstream, and that has an anti-cancer effect. That is going to produce a lot of waste material, along with the other waste material that you have to detoxify from, modern living for decades. So the third prong is detoxification routines that you do daily, weekly, and monthly. So there's daily detoxification routines like coffee enemas. You do some weekly routines like baths and things like this. And then monthly routines at alternating intervals of juice fasts and colon cleanses and liver flushes. So it's a really holistic program. You're covering a lot of different bases, and you kind of do this, every day. Basically, when you meet with we call ourselves Gonzalez guardians, one of the docs that's educated in the Gonzalez protocol, or Dr. Gonzalez or Dr. Kelly, they basically, have a initial intake with you and then get your evaluation results back and then go over your whole program. And then you implement that at home with the help of your family and friends. And you do that day in and day out.
Okay. So you have a certain metabolic type. It's, this kind of range of supplements. What kind of happens from there with supplements? Is it this metabolic type gets these supplements, or are you still doing, deficiency analyses and that sort of thing? Or does it come down to like what kind of form of the vitamins they're getting? Or I would love more elaboration there. That'd be awesome.
Yes. So every person needs all the vitamins and minerals, but the amount can vary dramatically between one person and the other, especially depending on what nutrient we're talking about. So magnesium and calcium are a really good example of this phenomenon. Magnesium is very alkalinizing. So magnesium is needed in high amounts in the sympathetic dominant, overly acidic people. And you may give someone upwards of 1,000+ milligrams of magnesium a day. Now, calcium is acidifying. So you don't want to give someone who's already too acid a lot of calcium. And this is one of the theories behind why a lot of women, for example, um, are susceptible to breast cancer, because their doctors are recommending 2,000 milligrams of calcium a day because they have osteoporosis when they're postmenopausal. And if they're already too acidic, that's like throwing fuel on the fire. It's only going to make the issue worse. So with a person who's already too acidic, you don't want to go over a couple hundred milligrams of calcium. They still need calcium, but you need to be really careful of your ratios. That's going to be the exact opposite for someone who's already too alkaline. They need acidifying nutrients like calcium at high doses into the thousands plus, and lower amounts of magnesium. And that's a good example of a more extreme nutrient, because it has such a powerful effect on the nervous system specifically and on the acid alkaline balance. A lot of the other nutrients are going to be the gradient of difference between one side to the other isn't going to be as dramatic. But there is a gradient for really every vitamin and mineral that we use. So that's it. The dose is important. And then you also mentioned the form. Dr. Kelly and Dr. Gonzalez also found that certain forms of nutrients had an effect on the acid and alkaline balance as well. So citrate forms, for example, of the minerals tend to be more alkalinizing. Carbonate forms of the minerals tend to be more acidifying. So a lot of we call them carnivore types, the people that are parasympathetic dominant, overly alkaline, they're going to need carbonate forms of calcium, magnesium, etc. While the sympathetic dominant, overly acidic vegetarian types are going to need citrate forms of their minerals like magnesium citrate, calcium citrate, etc.
I love it. So it's the sympathetic dominant that tend to be acidic.
Correct.
Which I guess kind of makes sense. So what if somebody was sympathetic dominant and had like a really severe calcium deficiency?
You would up the dosage of calcium, but you would do it carefully, and you would watch their acid alkaline balance and watch their symptoms and watch their condition. So it's a great question. If someone's deficient in something, they need that. It's essential. But you don't just haphazardly give them the highest dosage recommended, because that may cause problems.
What all goes into figuring out what metabolic type somebody is?
Great question. So the first thing that you want to look at is what we call like metabolic archetypes. And basically there's different symptoms that are correlated with different side of the metabolic spectrum, sympathetic and parasympathetic. And it really correlates to sympathetic and parasympathetic physiology. Sympathetic nervous system is a fight or flight branch of the nervous system. So this is going to be activated when there's a stress response. It's not bad. It just needs to be balanced with the parasympathetic system. We all need the sympathetic and the parasympathetic branch. But the sympathetic system, for example, is going to shunt blood to your cardiovascular system, to your muscles. It's going to dilate your pupils, can cause sweating, heat. It's going to shunt blood away from your digestive tract, because you don't need to digest food when you're running from a tiger that's trying to eat you. So all the symptoms that are associated with the sympathetic nervous system are going to be seen in a heightened way or more frequently in someone that's sympathetic dominant. That's the opposite for someone who's parasympathetic dominant, which is the rest or digest branch of the nervous system. And again, when your parasympathetic system is turned on, that's going to bring blood to your digestive tract. That doesn't mean that you're going to have no digestive problems, but sympathetic dominant people tend to be constipated because they're not getting enough blood flow to their digestive tract and nerve firing to their digestive tract. So they're going to be backed up. Parasympathetic may have diarrhea because there's too much, right? Parasympathetic individuals tend to have an overly active immune system. So they tend to be the people with autoimmune issues, allergies, asthma, depressed, tired all the time, chronic viral infections, chronic fatigue. There's a reason why the paleo diet has become so popular for people with autoimmune conditions, because that's the diet that typically those individuals need. When you are too alkaline, in a too alkaline state, you're susceptible to all those chronic immune issues. So that red meat and animal fat is going to really acidify your system and put you in balance, strengthen your immune system, etc. So that's looking at just your symptoms, whether you're a doctor observing your patient, seeing your patient in your office, or even just reflecting on your own self, you can kind of see your tendency along the spectrum. Dr. Kelly actually developed a long questionnaire that was thousands of questions long in order to go through every single symptom that the nervous system can produce, like pupils constricted or dilated, skin dry or moist, flushing or pale, rigid muscles or flabby muscles, on and on for every single system in the body, in order to really make sure that he was seeing the whole picture, not missing anything. It's very easy to look at something like high blood pressure or anxiety and be like, well, that person's sympathetic dominant. And we can't fall into the stereotypes because we may type the person incorrectly. So you can make some generalizations based on symptoms and the person's diagnosis. But unless you're looking at the whole picture, you could miss it. So that's one piece. A really important piece is looking at the person's acid alkaline balance. This can be pretty challenging to measure. A lot of people will do salivary, like pH testing, or urinary pH testing, but there's a lot of checks and balances in the body that may make it so that you're testing acid on a pH strip, but it's really not indicative of the real tissue pH, which is what we really want to see. So we have our own experimental hair test that Dr. Gonzalez used in his practice. We also use that can measure both acid alkaline balance and sympathetic parasympathetic. There is some correlation as well with certain ranges on typical blood work, like complete blood counts, metabolic panels, lipid panels, urinalysis, that Dr. Kelly worked out. And we're still trying to clinically assess the validity of the ranges that he worked out. And, if they're off, to tweak those ranges. But of course, there does seem to be some correlation with the minerals and pH and all these things that we can look at through blood work. That would only make sense that you'd see certain patterns with different types of people, but we haven't fully fleshed that out yet. So yeah, it can be challenging. It's obviously best to do it in, a clinical setting, but the Gonzalez Foundation does have a metabolic questionnaire that we've produced using Dr. Kelly's questionnaire and making some tweaks to it. So you can get a general idea of where you fall just with that questionnaire.
What your thoughts are on using bicarbonates?
One treatment for cancer that is very interesting to me. I wish I could remember this doctor's name. You may know Ryan. He's a Italian doctor that
Stevensini.
Yeah, and he does the bicarb injections
straight into the tumor. Yeah.
Yeah. Now that makes perfect sense with the acid alkaline model that would work, especially considering that most visible tumors that you would be able to inject into are going to be solid tumors, and solid tumors are the ones that are overly acidic, sympathetic dominant. It's what we call the soft tumors, or the immune system tumors, like leukemia, lymphoma, sarcoma, myeloma, etc., that are too alkaline. So you're typically going to get like those visible tumors like coming out of the breast and other places with solid tumors that are too acid, and those are going to be very susceptible to that sodium bicarb injection because it's so alkalinizing. And what this doctor has observed is that like the tumor just involutes when you inject it with sodium bicarb. So I'm all for that treatment. I don't have a lot of experience with it, but theoretically it makes sense. It seems like it has good research and case studies behind it. If you have a tumor that's visible and you're easily able to inject into it, it seems like that would be useful. You just, again, have to make sure that you're always understanding this idea of metabolic typing, and that not every cancer is too acid. A lot of them are, but some cancers are too alkaline. And if you're doing things that are alkalinizing the body in an overly alkaline state already, that's going to cause major problems.
So is that a 100% ironclad rule of thumb there? The solid tumors are too acid, and the blood, lymph, bone-ish type et cetera, the emias and the omas, those are too alkaline? Is there any exceptions to that rule?
It's so consistent that I would almost say it's a rule. There's a few cancer types that will that tend to be more balanced or can jump from one to the other. The biggest the cancer type that has the biggest variety of metabolic types that you'll see clinically is melanoma. Melanoma tends to be a parasympathetic dominant alkaline cancer, but we can see that in patients that are too acidic as well.
When we're saying that cancer type is too acidic or too alkaline, does that also translate to the person is too acidic or too, like if you have a solid tumor, you as a person are going to be more acidic, not just, quote unquote, the cancer is too acidic?
Correct. Yep. And I'm using these terms also interchangeably with sympathetic and parasympathetic dominant.
Yep.
So sympathetic and parasympathetic is kind of like a macro look at how the whole organism is functioning, because your autonomic nervous system is the part of your nervous system that controls every function in your body that's not in your conscious control, which is basically like every vital organ and every biological process. An imbalance there is going to have a massive effect on the entire organism. And then the acid alkaline balance is really happening at the cellular level, at the tissue cellular level. And yes, from this perspective, cancer isn't a local phenomenon. It's a system-wide organism issue of acid alkaline balance along with nutritional deficiency and toxicity. And you get all these things together chronically over years, if not decades, that's going to lead to cancer.
What are your thoughts on SEAC, the good old SEAC-T, Dr. Orton?
Haven't tried it. I believe in herbs. I've been trained in herbs. I train in homeopathy, which it's another version of herbal medicine that's energetic in nature. So a lot of the indications for herbs will actually translate to homeopathic indications. So they're kind of along the same spectrum. So I believe in various herbs' ability to detoxify the system, to drain lymph, etc. I can't speak to it. I don't have personal experience. As a general rule of thumb, again, I think it's really easy to grasp for things that are so simple like that, but it really, in my perspective, anything that has anti-cancer properties, let's say, has to be done in a setting in which there's many different variables that are being addressed that are probably not balanced. So I'm open to it. Dr. Gonzalez believed that the enzymes in the program, along with the other pillars that you do on a full program, was plenty to have the effect that he was looking for. So doing things like SEAC-T, was not necessary. I think that it's also all of us can be susceptible to wanting to do every single thing that we read that's good, and that can also have a detrimental effect on the system, because you're going to get counteractions, and sometimes you can detoxify the body too much. For example, you have to really work with the body, listen to the body, understand what's happening. You can't just throw a bunch of things at it and have it deal with it, right? So when you really treat the body holistically, you're fundamentally working with nature, working with what the body is already trying to do. So you don't want to work against it by like throwing the kitchen sink at it. So just a word of warning to like, what Dr. Gonzalez always recommended his patients do, and what I say to my patients now, is like, choose a path that you believe in your heart and soul 100% and go all in with that. And don't think that you have to do every single thing under the sun to get better.
This is a guest question. Can someone take enzymes as a preventative? What are your thoughts on, have a cancer diagnosis? Would it be a good idea to take some pancreatic enzymes here and there to make sure to keep it away?
Absolutely.
On an empty stomach.
Absolutely. Dr. Gonzalez did it. Dr. Kelly did it. It's a great way to put yourself in a good spot. What Dr. Gonzalez always said, which I agree with, is if you're going to do enzymes, you got to do the enemas, right? Because the enzymes are going to be doing continual cleanup. So it absolutely can work as a preventative measure, but don't do it without doing regular detoxification like coffee enemas to make sure that you're detoxifying the waste that may be produced by the enzymes properly.
Another interesting question on the Gonzalez protocol: is the protocol best for particular cancers? And obviously we just went through, how it gets applied very specifically to all sorts of different types of cancers. But, I know like Gerson is known, I think even on the Gerson Foundation website now, they have a list of kind of known cancers that it does really well for, and ones that you'd probably want to try something else. Is there any, I know it became famous with pancreatic cancer, but any that jump out as these you've seen them do the best, or the foundation has seen these types of cancers do the best on the protocol versus ones that are maybe more hit and miss, and anything like that? Or is it kind of even across the board?
So if there's more blood flow to the tumor site, it's going to be easier for the enzymes to get there. That makes leukemia, for example, very easily treated. I'll put easily in quotes, you know what I mean? It apparently, based on particularly Dr. Kelly's experience that I researched, he said that leukemia responds very well to the program because there is, leukemia is essentially happening in the bloodstream. So it's like there's a direct flow of enzymes that can go to the tumors. If you have cancer types that don't have good blood flow, I wouldn't necessarily say that it's harder to treat, but it takes longer. And sometimes time is not on your side when it comes to cancer, so it's a consideration. One example of this that's not a primary cancer type, but it is very common, is a tumor that happens in a radiation scar. So there's a lot of scarring in the area that is going to make it difficult for the enzymes to get to the tumor. So that's a consideration. That's where the bicarbonate injections may be really, really useful for someone like that, because if it's visible and you can inject into it, then that could be a really good alternative. But yeah, in general, the program can work with almost anything. You want to be aware of blood flow. Primary liver cancer can be a little bit tricky as well, because the liver is so fundamental to the detoxification process, it's involved in any cancer type. It's going to have a primary role. So that can be a little difficult. Again, it's been treated successfully by Dr. Kelly for sure. I believe Dr. Gonzalez, primary liver cancer. I believe he's got a case study in one of his Conquering Cancer books. So totally treatable. But yeah, some considerations there. And it's interesting what you said about Gerson. You know, one of the reasons in our perspective why the Gerson therapy doesn't work with certain cancers is because obviously the Gerson therapy is an alkalinizing diet and supplement plan that's going to work very well with acidic sympathetic dominant tumors, but not well with leukemia, lymphoma, myeloma, sarcoma, et cetera. And I believe that they've been well aware of that. And there's a lot of correlations between the Gerson and the Gonzalez. Lots of correlations with the enemas, the juicing.
Both love the coffee enemas. Yeah.
Yeah. So
You said juicing as well was, I don't, when Gonzalez protocol comes to mind, juicing does not come top of mind for me.
Yep. All patients that have cancer on the program should drink 4 cups of juice a day. It's not as much as the Gerson, but Gonzalez and Kelly totally recognized it as a way to get high amounts of enzymes, nutrients, minerals, and vitamins, beta carotene, particularly. Carrot juice is really prized in the Kelly Gonzalez model. So getting all those nutrients in a very easily digestible fashion. I've worked with many cancer patients that have had issues digesting food because a lot of digestive compromise. So juicing can be really helpful for those individuals.
So where does that jive though with the parasympathetic, sympathetic? Because juicing, I mean, I'm trying to think of an acidifying juice, and I'm having a hard time under the Gonzalez Kelly model, the Gonzalez protocol. I mean, are you still giving juice to the parasympathetic folks?
Great question. And it's so hard to get it straight. So
yeah, it is. Yeah.
You got it. Yeah.
Gymnastics there for a minute.
Yeah, you got it. So yes, carrots are quite neutral as far as the acid alkaline is concerned. And carrot juice is recommended for all types. Now, I want to say something about the parasympathetic types. It's not to say that you can't have any alkaline foods, right? I'd say the breakdown is like 70-30 or 60-40, but you're definitely emphasizing a lot of the acidic foods like red meat and fats and things like that. But parasympathetic folks can still have fruits, for sure. Tropical fruits are really good for those individuals actually, because high amounts of enzymes that they may be lacking in from not eating as much of the raw vegetarian style food that the sympathetic types eat. So getting that like high enzyme dose from tropical fruits can be really good for parasympathetic types. So they definitely had fruits. Green juicing would be something that you'd probably want to avoid for a parasympathetic individual, because greens, leafy greens, are one of the most alkalinizing foods that you can eat. So green juices, extremely alkalinizing. Salads, extremely alkalinizing. Citrus, lemons, limes, orange, grapefruit, extremely alkalinizing, which kind of can confuse some people because they consider like lemons to be acidic in taste, but they have what's called an alkaline ash, which means that when the body breaks it down, it leaves over alkaline components. So a squeeze of lemon or a hot lemon water is very, very good for sympathetic dominant folks. Orange juice can be really good for those types as well, but you definitely want to avoid that if you're parasympathetic dominant.
So now I have to ask where this fits in the Gonzalez model, Gonzalez protocol. You know, I've interviewed Dr. Patrick Vickers of the Northern Baja Gerson Clinic several times. You know, probably Gerson's biggest modern day advocate in terms of, well, he gets out there and preaches the gospel more than anybody else I'm aware of. And you ask him the does sugar feed cancer question, and that gets him foaming into the mouth, and it'll talk your ear off for 20 minutes about how, no, it feeds your healthy cells and all this sort of thing. Where does that question land? I mean, you just mentioned a lot of, high fruit sugar fruits and vegetables, that sort of thing. And I know Dr. Gonzalez was not a fan of the keto diet in general, but on the flip side, is there any credence to the does sugar? And of course, we're talking natural fruit sugars here. Any caution to fruit sugars under the Gonzalez model?
No. My understanding of it is that it's basically just a theoretical myth. I believe it was Otto Warburg that developed the idea that cancer, sugar feeds cancer, or that tumors like sugar. Let's put it that way. But I believe that Warburg also said that even if you brought the sugar down to zero, that wouldn't make the tumor go away in and of itself. So what you're going to do there is you're also going to really slow down your metabolism, because natural fruit sugars are used by the body very quickly as a form of energy. So you're going to rob Peter to pay Paul. If you're a sympathetic dominant individual, you're going to totally push yourself in the wrong direction. And, if you look at the diets that Dr. Gonzalez put people with stage 4 metastatic cancer on, they were high sugar diets. I mean, they were 4 vegetable juices a day, mostly carrot, which has high natural sugars, fruit multiple times a day, fruit juice if you'd like, throughout the day on top of your vegetable juices. So there's no evidence outside of the theoretical model to support that's real.
I love it. This just made my day. Yeah, and I believe Dr. Vickers also, he brings up Warburg and says that Warburg's work was kind of bastardized
Yes, right.
misinterpreted to
Yes.
come to the conclusion that, sugar feeds cancer. And that's, nowhere did Warburg actually say that. You just kind of have to take his work and then follow it down a few more steps of your choosing to get to that conclusion. How about juicing beets, as beneficial as carrot juice?
I'm not sure. They have different properties. Definitely Dr. Gonzalez recommended juicing beets along with carrot, but in the Gonzalez protocol, carrot was kind of like the foundation for all the juicing. And my understanding of that is that it's particularly concentrated in nutrients, particularly beta carotene, which is very important to get enough vitamin A to support your immune system when you're dealing with the cancer process. So that was kind of the rationale for carrot juice, but I think juicing beets is great as well.
Yeah, I mean, we juice a whole lot of carrots, but then we juice a whole lot of everything else on top of it too, because it's all good stuff. When we hear about quote unquote anti-cancer enzymes, serapeptase, bromelain, trypsin, chymotrypsin, all these things, what makes pancreatic enzymes so much, special in that regard versus all these other, known anti-cancer property enzymes that we hear about?
Yeah, great question. So I think it's a simplistic way to look at enzymes that it's literally digesting the tumor. Okay, and that may be occurring. But I think it's more useful to look at it as a signaling mechanism. So Dr. Beard, that discovered this concept that pancreatic enzymes have this anti-cancer effect, figured that out by looking at histology slides of this growing fetus that was growing into the mother's uterine wall. And what he noticed is that the growing fetal cell would invaginate into the mother's uterine wall, essentially invade it, and it had undifferentiated cells that would invade it and then would produce angiogenesis to start pulling from the mother's blood supply. And when he looked at that under the slide, histologically, it looked the exact same as what a cancer tumor looks like. And he asked himself, well, what stops that process that from happening, from continuing in normal fetal development? And the beginning of the fetal pancreas production of enzymes stops the process. So there's something about the pancreas when it turns on in the fetus that prevents that process from continuing on further. And he noticed that again and again and again, that the day that that stopped occurring, that proliferation stopped occurring, was the day that the pancreas turned on. So yes, there's probably a digestion happening with the enzymes, but the reason why pancreatic, and particularly trypsin, chymotrypsin, is because it's a signaling mechanism for the stem cells that are seated all throughout the body that are starting to proliferate to stop doing that. And that's the best I can say about, again, I don't have any experience giving someone high doses of serapeptidase. So, and I wouldn't be willing to bet that chance because we already know the pancreatic enzymes work. So it's a good question, but that signaling, I think, is really the important thing.
Dr. Orton, this has been a real treat. One more time, recap where folks should go to learn about the Gonzalez protocol, where folks go to learn about you, to work with you.
Yeah, absolutely. So probably the best place to go if you're interested in doing this protocol is the Gonzalez Foundation's website. They have a button that says apply here. And you'll go through an application process. You'll write a letter about your experience and why you want to do the program. And then you'll submit your lab work, and then they'll have an interview with you to kind of have a chat, make sure everything is good. And then if you pass through that application process, then you'll be able to choose from the directory a doctor that you want to work with. My website is havenholistichealth.com. And you can always schedule a free consultation on my website if you'd like to chat with me about moving forward with working together. But again, you can also do that through the Gonzalez Foundation. And if you do have cancer particularly, and you're looking to do this, I would recommend going through that route.
And again, this episode was highlights from one of our Going Integrative Plus Q&A calls, where we get a top holistic cancer doctor on a call once a week, and our members get to ask whatever it is they're currently trying to figure out. If you would like to hear the rest of the 2-hour call, along with over 100 other calls we've done, along with the recordings, notes, and slides from our entire first and second Anti-Cancer Revolution online conference events, and most importantly, the ability to ask the doctors and healers featured on our events and community calls anything you want yourself directly, that's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week, we get one of the top holistic and integrative cancer doctors on a call, and you get to ask them anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. Again, you also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, timestamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And always remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.